how's everyone doing today? Happy Wednesday. It's hump day, right? So today we got an awesome topic, talking about tumescent anesthesia. And so for those of you who may be new to these talks, every Wednesday I talk about a liposuction related topic, and I do accept questions. So if you want to leave some comments down below, if you had a specific question that you wanted to ask me, I can try and get to that. But if I don't get to it during the video itself here, I do personally answer the Facebook questions down below. So feel free to ask me any questions. This is a way for you to interact with me and ask anything that you have questions about. So today we're talking about tumescent anesthesia. What is tumescent anesthesia? So tumescent anesthesia it's the way that we are able to do liposuction under local anesthesia, which means that we can do it while you're awake and we only numb the area that we're treating. So this was a breakthrough back in the 80s. There was a doctor, Dr. Klein, down in San Diego area or Mission Viejo or somewhere around there. He's actually still in practice. He's an older gentleman, but so when he was in school, he had this idea that liposuction could be done differently, that we could do it while patients were awake. And so he had this idea to use just pure lidocaine and numb a local area and then remove the fat from that area with liposuction while the patient was awake. So he tried it with a small local area and it worked out great. The patient was numb and he had no issues, and he was able to remove fat while the patient was awake. So he was all excited about that. However, lidocaine, like any other drug, becomes toxic. So when you use too much of it, then it can cause side effects, and it could even lead to heart attacks and things like that. So the important thing is to not use too much of the lidocaine. So what he found is that you can actually dilute the lidocaine by mixing it with saline, and saline is just salt water. So we mix the lidocaine within the saline, which it dilutes it and allows us to spread it over a much larger area. So what he did is he did various tests with different concentrations of lidocaine in mixtures with the saline, and he found his optimal dilution was about 800 milligrams of lidocaine per liter of saline. So that's what we use. Not that that's really important to you guys, but we use lidocaine mixed with the saline, and then the other magical medication that we mix in there is called epinephrine. Now, epinephrine is a cool medication. It's essentially adrenaline. So if you guys think about when you get into an accident or something and your heart starts racing and you're like, things were crazy, and you're just like, this is your fight or flight response, and that's when adrenaline starts pumping through your body and you're able to do amazing things. Your heart starts racing. You may feel very anxious and anxiety when you get these feelings. But so that's what essentially the epinephrine is the drug within your body that does that. So now, how does it help us in liposuction? Well, what it does is the epinephrine actually constricts the blood vessels. And when it constricts the blood vessels in that particular area, it essentially pushes all the blood away. So when we remove the fat, there's almost no bleeding during the procedure, which is amazing. So the combination of the lidocaine and the epinephrine diluted in the saline, this is really the magic that allows us to do liposuction under local anesthesia. Now, how has this really changed, and how has it improved over the years? Well, what they used to do is they used to just put you to sleep with general anesthesia, which, by the way, is very dangerous. So, but they'd put you to sleep and then they just start sucking out the fat, and immediately the patient would the fat would come out dark red because the patient would be bleeding profusely. And so in the past, before the 80s, they would actually start giving transfusions immediately during the procedure, anticipating that the patient was going to have substantial blood loss. So that completely changed. And the additional bleeding at that time, it would cause more bruising. Patients would be laid up in bed for a couple weeks after the procedure. So this has really changed everything. And aided in the popularity of liposuction. So liposuction is now considered the most popular procedure in the world, with almost 400,000 procedures taking place in the United States alone. So it's extremely popular, but it's popular because for a couple of big reasons. It's significantly safer than it was in the past. So when you use tumescent anesthesia and do this under local, the procedure, there's very few side effects, there's very few problems that we encounter. And that's why our patients, 70% of our patients fly in from out of state. They have the procedure and they fly out the next day. It's that easy. You may have heard the term lunchtime lipo. One of my colleagues actually coined that term. And that just refers to simply we can actually do liposuction while you're on your lunch break and you can go back to work. In fact, one of my employees, our office manager, Brandy, some of you may know her, she had her outer thighs treated and she literally did that. She clocked out, had the procedure, and then clocked back in immediately afterwards and kept working and finished out the day. So it's absolutely possible with local anesthesia that you can return back to work the next day, sometimes the same day for many of our patients. It really just depends on your motivation. But it's really the magic of this tumescent anesthesia that's allowed for substantially less bleeding. It allows that we do it while you're awake. So why is that important? Most people say, oh, I just want to go to sleep, right? I just want to go to sleep and wake up when it's all done. Now, the problem with general anesthesia is that it's not as simple as just going to sleep. It's not like laying down on your bed and you hit the pillow and you go to sleep like that. It's not like that at all. In fact, they have to give you medications that stop you from breathing. And you may be familiar with this medication called propofol. Propofol is the medication that actually puts you to sleep and causes that amnesia. And this was the same medication that killed Michael Jackson. And as you may remember, Michael Jackson had difficulty sleeping, so he had his private doctor, who was not an anesthesiologist but in fact a cardiologist. He administered propofol, the medication, and it stopped Michael Jackson from breathing. Now, the reason why he died was simply because he was doing this at his house and they didn't have the proper equipment to do general anesthesia, to use propofol. So when he stopped breathing, there was really not much to do. Now, I don't know the details of that, and that's that's a different talk. But the point is that general anesthesia, just going to sleep, it's not just going to sleep. It's not safe. In fact, most of the complications with any surgeries, it comes from the general anesthesia. So it's the most dangerous portion of the procedures that you get with any procedure. So whether it's liposuction or any other procedures, like a knee replacement, hip replacement, if you get abdominal surgery, brain surgery, all these you get general anesthesia, and it's usually the general anesthesia that causes problems. If you've had general anesthesia in the past, you may have stories of waking up, vomiting and feeling just weird. I've had numerous patients say that they feel cloudy for weeks, even months after the procedure because of the medication, and it really plays tricks on your mind, and it does affect your body. So it's not as easy as just going to sleep. And some of the younger people, they think that they're invincible and nothing can happen to them, but I assure you, it's not something that I would recommend to any of my family members. If we could avoid general anesthesia, you want to avoid that as much as possible. You want to do general anesthesia when you absolutely have to. So there's definitely procedures nowadays that you have to do it under general anesthesia because the trauma from the procedures are too much to do under while the patients are awake. So save those general anesthesia days for days when you have to. So perhaps when you get older and you have abdominal surgery, or you're doing heart surgery or something, save those days for anesthesia for something more important than liposuction. Because liposuction, it can easily be done under local anesthetic, and it's substantially safer, and we get fantastic results. And one of the reasons why the Tumescent technique is better than general anesthesia. So if you can imagine with general anesthesia and you're asleep, right, and you're dead weight, you're not moving, you can't move, In fact, they actually give you medications to paralyze you so you can't move. And the problem with that is that with liposuction, you know, people aren't flat, right? So when we treat, we'll treat all the way around the waistline to create that hourglass figure. And the best positioning to get to the sides is when the patient is literally laying on their sides. However, if you're also getting the front of the abdomen, then that means that in the middle of the procedure you're going to have to flip from side to side. Now with general anesthesia, this is not as easy, typically because they're doing it in the operating room and everything is done sterilely, so they actually have to take down all the drapes, flip you over, and they have to get multiple people to help flip you over because you can't move yourself. And then they get you into position. They'll typically put some things to hold you in position there, and then they have to re-drape everything and do the procedure from that position. And it's my understanding most of these doctors, they don't want to do that. So they usually cut corners and they won't turn you all the way on your side, and they'll just get you far enough to the side where they can kind of get something back there. And the reality is the results, they're simply not as good as what I do, because I have far better positioning. And I'm able to access the area where I want to get to, and it's not difficult. And imagine if it's more difficult, you're probably not going to do as good a job. You're going to struggle, and you're going to probably quit before the job's actually done. Whereas I can take my time, I have good positioning, I'm able to get to the area that I need to, and we tend to get better results because of that. So tumescent anesthesia is absolutely critical for liposuction, and there's no reason why anybody should be getting liposuction with general anesthesia, which ironically, plastic surgeons who claim to be the best at liposuction, they still do it the old way, which is bizarre, right? So they still put you to sleep, they still cause, have all this additional risk involved here. But not only that, general anesthesia has to be done at a hospital setting where they have proper equipment to a breathing machine that'll breathe for you. So they do what we call intubating. So they put a tube down your throat which breathes for you. So you have to have this big special machinery. And then you also need a second doctor then. So you need an anesthesiologist to monitor everything and make sure that things don't go wrong, because they do go wrong. So you'll need a separate doctor there to monitor that. In addition, the OR staff, you're going to have nurses, you're going to have operating room technicians, you have people cleaning the room. So literally there's probably 10 people that are involved in this. So you can imagine all those people have to be paid. So general anesthesia is substantially more expensive, and obviously hospital fees are substantially more expensive. So that's why when you go to these plastic surgeons and their prices are, oh my gosh, ridiculously expensive, and then you see our prices and we are not, what's the difference, right? A lot of people, I think the tendency is for people to believe that lower prices means lesser value or lesser quality, and higher prices means higher quality. And the reality is that these plastic surgeons, my competitors, they simply are charging more not because they're better, when in fact they are charging more because they have to cover more overhead. They have to pay for the hospital fees, they have to pay for the anesthesia fees, they have to pay for the other staff. All this stuff is very expensive. I mean, we're talking thousands of dollars. So that's why their prices are substantially higher than ours. The other thing you got to consider is that a lot of doctors will charge for their time. So if they anticipate being in a procedure for 5, 6, 7 hours, they're going to charge appropriately for that. And again, that's why their fees are astronomical. In contrast, I've been doing this for almost 10 years now, and I've done well over 15,000 procedures. I do this every single day, and I have substantially more experience. And in doing so many procedures, I've gotten really good at it, and I've gotten very fast at doing these procedures. So what might take someone else 3 hours, I'm usually doing within an hour or less. What takes other people 5, 6 hours, well, I can do it in about 2 hours, maybe 3 hours. So I work a lot quicker, which is, it's awesome for the patients because it's less traumatic, and it's the whole experience of being on the table is not a fun experience. It's a necessary evil. It's what we have to do in order to get the results. So if we can shorten that time at all, it's going to benefit the patient. Not only that, the longer that you're on the table, the longer you're bleeding. the longer you're swelling without compression, the more potential problems that you could have. So the quicker that we can get you done with the procedure, the quicker we can get compression garments on there, quicker we can decrease any bleeding, potential bleeding from the procedure. So it's substantially safer to work quicker with this. And the advantage that you benefit, obviously, is that since I work quicker, my time is still valuable, but I don't have to charge you as much because I can actually do more procedures in that time that I save by working faster. And I don't want you guys to think that I rush through things. I absolutely don't rush through things, but for me, it's like the pace that I work is fast, but it's that way because I've been doing that for years. And it's just I use this analogy. I used to run marathons, and patients say, "Oh, your arms must be ridiculously tired," and it does get tiring. However, I've been doing liposuction for so long, it was just like training for a marathon. At first, it seems really difficult, and you run 2 or 3 miles, you're like, oh my gosh, I can't believe there's no way I can run 26 miles. You start running, you keep running more, and you build up your endurance, and next thing you know, you're running 8 miles, 9 miles, 10 miles, and you still see, I mean, that's not even halfway there, right? So, and it's still difficult, but you keep working, you keep training, you keep building your endurance, and eventually, you get to the point where you can run 26 miles in a few hours. So I was able to do that, and that's kind of the same concept that I use with liposuction and training. I work out extremely hard. I work out every morning. I stay in really good shape to be able to do this, and I feel like I train like a professional athlete, so I don't get hurt. Because what I do is very strenuous. I'm sweating. It's very hard. It's a lot of repetitive movement. When you do a lot of repetitive movement like that, you get issues with like shoulder pain, elbow, wrist, and these are all potential injuries that I could have. But fortunately, I've been able to avoid these over the years by taking care of myself. And I'm in good shape, so I can do this and do this quickly for people. And I work fast because that's just the pace that I'm comfortable at. In fact, if you think about it, if you are a runner, you might be able to appreciate this, but when you run and you have a faster pace, normally when you try to run slower, it just doesn't feel right to you. So there's typically like a comfort pace that you'll be moving at, and that's just normal. I mean, you'll see some people that they just normally walk faster, and other people walk slower. Some people do things faster. I mean, that's just the way it is. So I do it faster just because I'm comfortable with that, and I get better results when I do things in my comfort zone. So I've found what I do well, and I just continue to do it over time, and it builds habits. So some of you may watch some of my other videos we do on Mondays, our Motivation Monday, where I discuss a lot of the books that I've been reading, and most of the books that I've been reading we're talking about habits and how we can change our lives through implementing better habits. And I think one of the major reasons why I've been successful with liposuction is because I have good habits. And I've created these habits over the years, and I've implemented these, and it has allowed me to get very good consistency because I do the same thing every time. But also, because I do the same thing over time, it allows me to get in a routine, and I can create patterns, and I can go through the same process every time with a patient, and that way I can get these consistent positive results. And I've honed my skill over the years, and I've really worked on this, and in fact I'm still changing. I'm always changing. I'm always trying to improve. When I have issues, if I find, when patients come back a couple weeks later and we find issues that we have to fix, I'll adjust the way I do procedures to begin with so we don't have the problems afterwards. And there's quite a few of these things that I've seen regularly. For example, on the abdomen, it's our most common area. So on the abdomen, sometimes it's really hard to get the fat right around the belly button, and it's commonly left behind. And what I've seen from a number of my competitors is that they tend to leave fat behind, and it ends up with this, what we call the donut deformity, because it literally looks like there's a donut right around your belly button because there's fullness just around that area. And the problem is that the belly button itself is kind of, if you imagine, it's kind of cylindrical. So it goes, from the outside in, and the fat is surrounding it. So it's difficult to get the fat surrounding that area And one of the reasons is because people tend to be more sensitive in that area. So it's one of those areas that with liposuction, it can be uncomfortable. It just feels really weird because you're working around that belly button. And so because they're uncomfortable there, they may complain about it. And if they complain about it, we'll tend to not go to that area as often. And when we don't go there as often, it's going to be more likely that we forget, or we never get the fat out of there. So it definitely can happen that you get this donut deformity. But I've been doing this for so long, and I've seen it so many times over the years. I've made the mistake, and I mean, even when you give a conscious effort to make sure that it doesn't happen, it still sometimes happens. So nobody's immune to getting this, and nobody's immune, for practitioners to experiencing this, me included. So I work really hard because I know that it's so common, because I know it's so difficult to avoid this. I really work hard to make sure that it doesn't happen, and I try and get as much fat out of there as possible. So this is just one of the small things that I do on a consistent basis, but I've created patterns and ways to avoid many of the common pitfalls that happen with liposuction. And the only way that I've been able to do that is because I've done thousands of procedures. So imagine some other doctor who hasn't done as many procedures, they will not have had as many experiences, and it's the negative experiences that you learn from. And so you have to have them, unfortunately, and there's got to be the learning curve. So, fortunately, my patients now don't have to be my test patients. I'm not testing on them. I'm doing what I know how to do, what I know gets good results. However, some of my competitors who may not do as much, it's always testing. We're always trying. We're always trying to improve. We're always practicing to get better. The practice of medicine. So now back to the subject of tumescent liposuction. The tumescent liposuction has helped us do everything under local. So when you're awake, and the ability to flip side to side has allowed for better positioning to get the more fat out in a more uniform pattern, so we can get more consistent results. Now, again, to summarize about the tumescent technique, the ability to do liposuction under local anesthetic is by far the safest way to do liposuction. And if you're thinking about doing liposuction, it's really, I wouldn't consider doing it any other way. If you were my family member, I would not even consider doing general anesthesia, because it's just not safe, and there's no reason why you would have to do general anesthesia. So unless you are one of these people that you don't tolerate anything, and you have such a low tolerance for pain, and you have super high anxiety, these people, they tend to not do well under local anesthetic because the whole process freaks them out. And a lot of it's a mental game. So as with most things, it's the way you think of these processes. And for a lot of people, having anything underneath their skin, and since you're awake, you'll still feel vibrations. You'll still feel kind of a tugging and pulling sensation as I'm moving back and forth. You may feel pressure. All this is normal, and it just feels weird. I've had the procedure. It feels so weird. It's bizarre. But most people tolerate it just fine. The people that don't tolerate it well, it's my belief that a lot of them, it's in their head, they perceive it as being bad. They perceive it as something really bad is happening. And our bodies, we have pain as it gives us a signal to let us know that something is wrong, that something is happening that shouldn't be happening. And so that's why we feel pain. For example, you put your hand on a hot stove, gets hot, you burn your hand, you pull your hand off, right? And next time you remember the pain, don't do that, you don't touch something hot. So it's the pain that is a signal for us. So a lot of people misinterpret the pain and discomfort and thinking that something really bad is happening, and it scares them. And when it scares them, it makes them, it triggers that fight or flight emotion, and that response that we get, and you just want to get away from whatever it is. But obviously you're on the table, you can't get away, so a lot of them they'll get emotional, they'll get anxious, and the people that tend to stay the calmest and composed and most relaxed, those that I find the ones that practice meditation and are able to really focus on their breath and less on what we're doing, they tend to tolerate this substantially better. So Now I can tell you, if you're out there and you're worrying with, is this uncomfortable, is this painful? Now the tumescent technique, the getting numb process, injecting the numbing fluid into the fat layer, that process, since you're not numb yet, you will feel, and you're going to feel, most people describe it like a pinching sensation. And it can be uncomfortable for some people, but others may not feel it at all. So if you do feel discomfort, this is a very short period of time when we're injecting the numbing medication in there. It's a small portion of the procedure, so you just have to be aware that it will be over quickly, and so you just have to get through that portion of it. And once you get numb, you usually don't feel a whole lot after that. And if you do, we just put more numbing medication, and we can accommodate you. You just got to talk to us, and that's the cool thing about being awake, is you can talk to us and you tell us what's going on. So if something happens and you're feeling something weird, you can ask, right? Now, one of the bad things with general anesthesia is that when you're asleep, like let's say now let's say if the doctor doesn't know what they're doing, and they jammed the cannula into the stomach and it went through the muscle and into the internal organs. Bad things can happen with that way. That is absolutely the worst thing that can happen with liposuction. But if you're asleep and they hit the muscle, they can go right through the muscle and keep going, and that could potentially be fatal. So in contrast, when you're awake, we only numb the fat layer, so that fluid goes and fills up the fat layer, and you're only numb in that layer, and you're not numb at the muscle, and you're not numb below that. So that's why you'll feel the vibrations, you'll feel the tugging and pulling. It does feel weird, but if we get too deep and we go and we hit the muscle, you're gonna feel that like that, and you're gonna jump off the table, and you're gonna tell us, oh my gosh, something's wrong. Okay, but that's okay. That's good. That's you alerting us that we're doing something wrong, which is a safety measure, and that's what makes the tumescent technique substantially safer than general anesthesia, because you can give us input. If we're doing something wrong, sometimes we don't know. We're humans. We're doing this, and we feel like we're in the right position. We feel like we're doing stuff, but sometimes we go in the wrong direction, and problems can occur. So no one's immune to problems. So the advantage of being awake is that if we hit the muscle, you're going to feel it will stop, and no harm done. In contrast, it's possible that these things happen. That's why most deaths that have occurred with liposuction, if you do any research, most deaths occur under general anesthesia. And I don't remember the last time I've ever seen anything in the news about a death with tumescent liposuction. In fact, I don't remember I've ever seen that. But it is possible. There's a bunch of moron doctors out there that are doing stupid stuff, and they make mistakes. So one of the ways, and I'll tell you, if you're concerned about safety, one of the ways that I do things to eliminate the risk of puncturing through the muscle, by the way, that's never happened with me, never ever. In fact, it's probably only 1 or 2 times we've even gotten close enough to the muscle where the patient complained about discomfort from that. But one of the ways that I avoid that completely is pretty simple. So if you can imagine, I grab the fat with a wide grip and I lift up. So I'm lifting the fat away from the muscle, and then my cannula goes right in between my hands, and so with my fingertips I know exactly where the muscle is. I grab and I can feel the muscle with my fingertips, and then the cannula is going to go above that, so I know exactly where I am at all times, and that's how I keep it safe and never even come close to the muscle. It's really, you just have to be aware of where the muscle is, and if you know where it is, you're not going to hit it. And you just have to be conscious at all time of what you're doing, where you are, what angles you're going with through liposuction. So again, tumescent technique, I keep getting off subject here, but tumescent technique is what has allowed us to do everything under local anesthesia while you're awake. It's substantially safer. We've reduced bleeding to only a few tablespoons of blood lost during a procedure, which is phenomenal. And blood transfusions are a thing of the past with liposuction, and it should never be done. There should be no reason why there should be a blood transfusion when you use proper techniques. So if you guys have any questions, please leave comments below. Don't forget, if you find this valuable, which I hope you do, please share this with your friends, tag some friends in the comments down below, or share it publicly. We appreciate all that. If you guys are interested in free liposuction, we're still doing our contest, and to enter the contest, you're going to simply text the word free lipo with no spaces, free lipo with no space, and text that to 44222. I'll also put down below a couple links. We have a link to a page for you to sign up for the contest. I'll also, if you guys are interested in a free consultation, so if you're ready to take the next step and you're ready to move forward and get your body ready for the summer, for your bikini body, whatever the head is, if you're ready to move forward, the next step is your free consultation. And those of you from out of state, don't be scared. About 70% of our patients fly in from out of state, so we've made it really easy. These consultations can be done over the phone with some pictures. So I'll put the links down below. Click there. If you guys want to talk to us, give us a call as well. And if you had any questions that you wanted to be answered in person, that's fine. We also do the consultations in person if you're local here. So don't forget, free lipo. Text that to 44222. 44222, and that's free lipo with no spaces. Thanks for watching, guys, and we'll see you again next week.